We'll give Lynn just a second to get all set up here, all dressed and ready to go. All right. Well, while she's doing that, let me thank y'all for having us. And yes, I am from the South, so you will hear y'all a lot, and so is Lynn. So we apologize, but it is just a part of who we are. And I want to thank Eric and Mike and Najir and Robert and Bruce for changing the schedule up and for your acceptance of that. I apologize. I had travel issues with Mother Nature. It has seemed to decided to cast its ugly spell on me all week long in my travel. So thank you very much. I appreciate it, gentlemen, for y'all changing things up. First of all, again, my name is Melanie B., and I'm joined with my colleague Lynn Nelson and Bob Bontempo. We are thrilled to be here today, and our approach today is helping you to understand GSI Health and who we are and how we started. And Lynn's going to take us through a demonstration of the product so that you can see from an overall standpoint how we are committed to what we do and how our platform actually addresses multiple programs, as well as how those integrated care teams. Yes, I'm sorry. I'm sorry, I moved so much. I apologize. So wanting to be a quarterback of those integrated care teams. I'm sorry, is this what you're going to use?
This is forward.
Okay, thank you. All right, so who are we? We feel that we are population health personalized, and that can mean many different things to many different people. Population health personalized to us is making it specific to your organization, specific to your need, and specific to your patients. What does this mean for you? And with that comes an integrated platform that has care coordination and population health analytics with its own built-in HIE that delivers population health personalized. As we go through this and as you think about a platform, I want you to envision one that is configurable, specific to your needs. We're not trying to define your workflow. We're trying to help support you in what you're trying to gain to for your objectives and goals specifically. We do have the depth, the breadth, the successful experience with managed care programs, with health homes, behavioral health, districts, ACOs, and community-based programs. In the state of New York, we have 1 in 5 patients on district, and in the city we have 1 in 3, and those are all served by GSI Health. Just to give you an idea of who our CEO is and where our experience started, he started back in 1998. And at that time, he was appointed to be an advisor to David Brailer and worked with that organization. He also was instrumental in developing the HL7 best standard as well as direct secure messaging. We stay continually involved in regulatory as far as what's happening and what's taking place so that we can continue to build upon what our expertise is. The other nice thing that we feel very proud about is that all of our client base is highly referenceable. And to give you an idea of some of those, and I'm just going to go over these very quickly, each of these organizations are different in nature. They may be a health system, they may be just a one entity organization that has downstream providers underneath. We're supporting behavioral health, and as you can see, it's reaching out into the community to go outside of those 4 walls within the clinical aspects and to deliver, bringing in those social aspects. Lynn likes to say, I like to pat ourselves on the back, so I'm going to do a little pat on the back and do a little rah-rah dance here. We have been selected by many organizations as a top 10 population health management solution and so forth, as you can read this, and I won't bore you with this, so we want to get to the good stuff. What is it that we do? We're solving your business problems at step 1. So what does step 1 look like? We want to be the drivers of your outcome, and I know that Eric had mentioned earlier that you see 67% of that impact is from the social economic standards. We have been shown with some of the research that has been done that it's actually up to 80% for some of the work that we're doing. And it's important that everyone is addressing the whole person, the whole patient. We don't want to be looking at half of the patient, but we want to be looking at the whole patient as far as addressing their specific needs. I'm sure that all of you can say this looks very familiar to you. Not only are we helping to drive the outcomes, but we're also looking to connect you with your community. As you know, you can have individuals that have substance abuse. It could be severe mental illness. It could be those that are homeless, those looking for a job, or those that are not speaking to what's happening within their own self. So all of these items work within our platform to address. Just to give you a high-level overview here, This outlines 5 specific patients, and within those 5 specific patients, they can be part of multiple programs addressing the specific care within that specific individual. They do not have to be assigned to one program, they can be assigned to multiples. Keeping in mind as well, many organizations look at us and say, so how are we going to do all of this? Are we going to have to hire additional resources? And the answer with GSI Health is no. It's minimal IT, where we're going to actually ask you what are those specs that you have. We're going to pull in and understand specifically from an IT perspective what you have. How does that move forward? We're going to create the quarterly updates and maintenance for that. And there's also a change request process in the system as well. So if you're looking to add or have updates, or you want to include, then you're going to work with your dedicated client manager to support you in those endeavors, and we will actually put that on our product roadmap. Lynn's going to show you something later on in just a moment that a client asked for about 4 or 6 weeks ago. They made us aware that it was of interest to them, and we were able to immediately design that, develop it, and get it into the platform, and it actually went live today. Also is that our help desk is local, and they are available 24/7. It's important to have individuals that return calls within an hour. You have a need, we need to be responsive, and we need to be able to address that. We all know that not just connecting, not just having your drivers to address, but you need to understand providing the whole person care requires the whole person picture. We all know that we want to stratify, and within the system it allows you to have that. And when your person isn't whole, you need to understand their family history, their living conditions, their medications, what crisis is taking with that person, and then how do you address it? So you're looking at the high priorities, the medium priorities, and the lower priorities. And as the priorities are changing, the risk is changing in these patients. Now, the platform also allows you to realize impactability. What's happening with each of those patients? Who can you truly make a difference with? Because we understand that there are some patients, no matter what we do for them, because of what's happening with that specific individual, we're not going to be able to change the risk. But what can we do? We can increase the quality of care. We can evaluate if there are better ways of making them more comfortable, no matter whether it's inside the 4 walls or we're outside the 4 walls. And the platform allows you to diagnose or be able to see that and how to move forward through it by addressing the whole person care. Just to give you an idea of overall, so we're driving, we're focusing, we're engaging, and when we look at the focus on quality and cost, again, for the whole person care.
Click right.
Click right?
No, one more.
Sorry, thank you. Oops.
Oopsie.
There we go.
There.
So we're beginning with integrated care teams, referrals, coordinated care plans, risk stratification, and community system of care, which leads you to a longitudinal care plan, which allows everyone on the care team to see and understand what's happening with those specific patients. You begin to hear a story, you begin to able to understand what's happening with them, and to be able to address their specific needs. So we feel confidently in the care coordination, the analytics allows you to have that population health personalized. Keeping in mind that it's personalized because it's customizable, it's configurable, it's flexible, and it has its own interoperability because it's own built-in HIE layer. Again, this gives you an idea of what the platform looks like. Everything that we've discussed now is on one platform. We're pulling in from HIEs, from Medicaid, from EHRs, through billing, through third-party systems, hospitals, MCOs, through batch files that we will upload for you, and direct networks. And again, that all comes through that HIE interoperability layer, through the care coordination data applications that we have, through the data warehouse for the analytics and the BI tool, and it's all in the cloud for you. We do have single sign-on. We do work with Epic, Allscripts, and other EMRs, so that when the doctor goes in and he enters in a patient's name, then we have a flag on their desktop or laptop or mobile or iPad, and it flashes and it lets them know that that's a patient in the GSI Health Coordinator. So that all they have to do is enter it in, and then it automatically toggles over and allows them to see what's happening from that whole patient perspective. So let me turn it over to you, Lynn.
Did you want to take a question, Robert, while we're doing this?
I know I ran through that quick, but I just wanted you to have a good overview before Lynn actually pulls you in and shows you what's happening. Yes?
Oops, that's not right.
Your algorithms, I'm not familiar that many people have something that has all those social factors, the risk stratification. You do?
Yes.
Wow.
The nice thing about the platform is that you can utilize ours or we can bring in yours, whatever your choice is. Again, we're not trying to define your workflow. We're here to support what you want your workflow to be and what you want your outcomes to be. And just to give an idea, I'm sorry, you're up. The dedicated client solutions manager that is assigned to the accounts, they actually are with you day to day. They're in specific accounts 2 to 3 times a week and then available by phone. They're doing on-site training. They're doing, it's face-to-face. And then they're doing monthly refresher courses. And then again, we're evaluating what's happening. We're attending your board meetings so that we can explain to your stakeholders is what's happening and what's taking place. Our CEO comes in once a quarter and meets with your board as well to go through that. If you decide an algorithm's not working or you're going to try a new one, great, let's put that in, let's look at it, let's evaluate what we were seeing before, what we're seeing after, and make those decisions. Is this working and what you want to identify for your specific needs? Thank you for that question.
Time check. Time check.
Kobe, you're happy for it.
Okay, great. So now you not only get to hear another Southern accent blaring through this microphone, it's a Southern accent with a cold blaring through a microphone. So I apologize up front. I also have one ear that's stopped up, so I'm glad you have microphones in the audience when you ask questions. So I'm going to take you through this sort of like a day in the life, very high level, and I'm going to start with enrollment. So if you read left to right, enrollment, care teams, some basic reporting in that part, care plan, message alerts, these are all part of that care coordination that we've been talking about since we started at 5 o'clock. But then we also have population manager, which is where we house the analytics. So I'm just going to touch on each one of them to give you an idea of the flow of how things work. Let me get familiar with your mouse here. All right, so I'm clicking on enrollment, and what I'll do is I'll select a patient, Bobby Brown, and the screen is much wider than I'm used to working with, so just track down here. So what you see at the top is demographics, contact information, emergency contact, etc. But I need to make some changes to Bobby, so when I go to the bottom, and I can't get it to go to the bottom, there it is. I'll modify things. Bobby's in my office, and he now has his 5th phone number since I've known him. And so I can go in, change phone numbers. I now have a new address. And anyone that is taking care of Bobby can do this, can go in, because a lot of their needs are changing, as they move around. So it's very interactive. The next section is the care management organization that they're assigned to, which in this case is GSI Health. In the next section, you have the ability to document that Bobby has given you consent to be seen by your organization. And there are 4 different levels. Not only is it auditable by date and time, but there's 4 levels. It could be pending. Maybe you've just discovered Bobby and you just want to get him in the system. Maybe you have now enrolled him. And lastly, if you get his consent, you're enrolling him. Then the last thing you do is assign Bobby to a care team. So this is all drop-down menus. If you have out-of-network providers, maybe you have Bobby's been going to a cancer specialist over in Harrisburg or somewhere really out of your network, we can click on this and we can add a provider here, or if they're already on the list, you just point and click, and you can actually physically add a provider here. So really gives you a lot of options for expanding your network. Okay, next I'll go into care teams. Oh, actually, I missed one. I want to tell you about this. So a lot of our clients have different programs that they like to assign their patients to. Like you may have a substance abuse program, you may have smoking cessation. There's all different types of programs that you may want to sign these patients up for. So as we scroll down again, there's a section. Having trouble scrolling. Let me do page down. Why can't I get to it? It won't go any further. Oh, use the arrows. Okay, that's easy.
That's what Robert is for.
Yeah, well, he used the arrows. I was doing the scroll. But when you click on modify, when Bobby has his care team set up, you can also assign programs. So on the left here you see here the parent organization, the programs within those organizations, all configurable by, of course, our clients. And you can establish the program start date, the end date, the end reason, etc. Just quickly wanted to show you that functionality while we're here. You can also see how many providers have provided consent. So you may want to focus on the ones with the checks have provided consent. These are all the possible organizations that could provide it. I could shorten that list and just show all of the organizations that he's provided consent to, or all of them in total. So next, we want to take a look at Bobby's care team. So we're going to go into the care team app. And this is really as easy as drag and drop. So at this point, I can view his care team, I can assign one that's already established, I can modify his care team, I can create his care team. So what you'll see here is his care team on the right. It's called the Tanner Care Team. But Lauren Ball has retired, and so we're going to take her off that list. Probably take her out of the system, actually. And he now needs a care manager. So I can quickly go up here, sort on care managers. It'll give me just my care managers, and then I can, again, drag and drop. And this can also create an alert, and I'll speak to alerts in just a minute. There's lots of different ways you can create alerts. When a care team member changes would be one of them. So I'll cancel out of that, and let me go over to, I'm going to go to really where it all happens in our software platform, and that is the coordinated care plan. So in this, for each patient, there are a number of things you can do, and most often used is the coordinated care plan and the assessments. It also has a place to put your encounters, your progress notes, etc. So let me just quickly show you the coordinated care plan. Now again, all of the providers providing Bobby care have access to him, and they can set up their own encounters. And so the system first takes all the strengths and the challenges of Bobby's and puts it at the top. So you kind of get a little narrative of it before you go any further. But at the bottom, you can see details. So for each issue, we allow a domain to be established, the status of the issue, again, auditable information on date and time, whether or not, it's a care team member priority or a client's, patient's priority. So if you click on one of these, and I'll just say, I don't know if this has any information. This doesn't have a lot of information, but you see how this opened up? When I go in and I create the need, it'll ask me, what are the challenges, what are the details, is there anyone collaborating with me on that? And then it goes on to establish the actual goals and interventions. So,
Patient wants to jump.
huh?
When you say patient wants to jump.
Oh, keep pulling your clock up, Robert. Yeah, wife is giving him headaches. He wants to jump. So actually, here's some goals. So long and short-term goals. The objective is help the patient to avoid jumping by completing 3 counseling sessions. So, and then at the bottom below that is the treatment and interventions, documented, anticipated start dates, etc. So you can track all of this. Now, I'll speak to this in just a minute, but these are the type of things that you want to track in something called a task plan. So it generates tasks and it gives you can assign dates for when they're due and follow through on those tasks. So that is the coordinated care plan. We also can, while Bobby's in our office, we can do a new assessment. So while Bobby's here, let's pick one that's, I think I saw a health home one in here. Yeah, here's a health home comprehensive assessment. So I want to assess the client. He's here in my office. And so I'll have picked the encounter date. Scroll down. And the visit type is admission. And when I hit continue, you'll see the assessment. Now, this one has a lot of categories. You've got the medical, you've got mental health, you've got financial, housing, domestic violence. These are all configurable. Now, we have a whole library of assessments. Good chance that a lot of these that you work with are in our library, but if they're not, we can tweak them or we can add new ones. Did you have something you wanted to add? Okay. All right, thank you. Let me cancel out of that.
And these would populate the EMR also?
Yeah. So speaking of that, actually, let me close out of that. Let me go to a couple of other things. We have the messaging works just like Outlook, and as it relates to referrals, when you select someone that you want to send a message to, you actually can use templates that are built into the system. Referrals order would be one. And it would be emailed through direct secure messaging to that provider. And there's also alerts. We work with you to set up whatever alerts you want, and there's a whole list of preferences, and for each category you can go in and say, well, I want to get alert every time somebody shows up at the ED, whatever your preferences are, and you can set them for whether they're high, medium, or low by user, and it also goes to their mobile app. So see, two more quick things. I keep going back to somehow Healthify. Did I just log out? I did. Somehow I logged out.
Yeah.
Yeah, that's what I did. Okay.
As Lynn's pulling that up, please keep in mind that all of the data that is being created through this and that's coming into the HIE is all reportable. So we have ad hoc reporting, we have operational reporting where we've prepared reports just on the care coordination side. We also have reporting from the analytics side that will help you to identify gaps of care. It will allow you to identify what's happening within each organization by patient, by care team, so that you can begin to look at and slice it and dice it that fits your specific program as well. Each organization that comes in or each individual that comes in the morning, you can have your own dashboard with all of your own reporting and everything that you want to see, what's happening in a day in a life or what needs to take place for your workers for that day, in the next week, the next 30 days, the next 60 days, and so forth as well.
So I also want to point out, this is sort of squished because of the size of the slides, but this is where you can keep all of your patients that you want to track, and there are icons to get you in things like the care book. The care book is where everything comes together. So all that data we're taking in from the EHR and any billing claims, anything, comes into the longitudinal patient record. And now the physician can see not only other members of the care team and email them directly, but as you see down at the bottom, you can see the allergies, you can see the care plan issues. You know, as it opens up, you see more and more information. Actually, I don't have any on that one, this one. Lab results would be another example. So all of this is coming in from the external data. So the last thing I want to show you, let me get out of this. This screen is really messing me up. I can't see how, the start and end. The X to get out of it. It's not there.
Show it to you.
See, I can't close it out. There's no X. Yeah, let's just minimize it. Perfect. I'm going to show one more thing. In Population Manager, this is where all the analytics happens. And so we set this up so that we have some standard reports, and then you can drag and drop any fields over to the standard report and then do a chart and graph. But I'm going to show you just a couple here. One is what Melanie just mentioned, a sample dashboard. So when I log in, these are dashboards that I want to see every time I log in, and track these on a regular basis. So patient enrollment goals, patient event notifications. Another popular one is the risk profile dashboard. And this is where you can look at the overall risk of a population based on zip code, based on age, any number of things. So let me show you how that works. This might appear fairly small for those of you in the back, but I'll try to use my mouse here. Here I can set high, medium, low risk, pick one or all three, zip codes, sort of cut off, discharge dates, etc. I can slide the bar and say I only want to look at 50 to 75-year-olds. And what's happening at the bottom is it's regrouping those patients in red, yellow, for high risk, medium risk, and then you can click into that patient to see more detail. One last thing I do want to show you is how our reports are set up so that you can actually, we built this so that you can run your own reports. So easy to run your own reports. So if I go in, I'm just going to give you one example. I'm going in analytics, and here we have a lot of reports. These could be HEDIS measures, these could be follow-up after hospitalization. I'll pick just one, comprehensive diabetes care. And what you'll see is we've sort of gotten you started with a sample, measurement month, enrolled patients, and you can add 2 or 3 more different measures there. And it's easy to, I'm sorry, Rob, I keep doing that. It's easy to drag and drop any of these fields over to that and slice the data differently. So if I wanted to put the payer up here as a row, I'll just put it up here in a row. You can drop it here or you can drop it over there. Now you see payer's been added. And then all I'll have to do is pick a chart. I don't know which one will look best, but we'll pick that one. There we go. So it's brought back a lot of data. You may want to cut back on some of your filters, but that's how they're all set up that way. We give you sort of a starting point, and then you can, export it to Excel, CSV, pick your own charts, etc., and save them and run them again and again. So I'll stop there.